We are back live at Bodywork Therapy Seminars. I'm Tom Maxson, LMBT. These techniques that we're about to do are intended to be used by professionals, trained, licensed properly, bodywork professionals. So use these with your own discretion and at your own risk. We're talking about high performance feet, and we're doing a routine to benefit people who are hard on their feet. We're going to start with a technique from Eric Dalton, a slinging of the ankle. It's kind of a myofascial release technique. We're grabbing the fascial bags of the calf. This is good to relieve plantar fasciitis and to improve blood flow in the lower leg. The Achilles tendon does not have very much blood flow normally. It takes a while to get warmed up. So I'm just going to kind of take a nice handful of the calf and move the heel back and forth. And you'll notice I'm getting some good movement through the hip, the upper leg. I'm seeing some movement here in the back, even all the way up into the neck. I'm seeing a tiny bit of rotational spinal movement, cervical spine. So this is great to introduce your presence to their body. It's very safe for them neurologically. We're not doing anything invasive to them. Next thing, I'm going to put her foot back down on the nice cushy bolster. We're going to take our fingertips, our couple of fingers on either side of the Achilles tendon and kind of do a shimmying, rolling motion, again to warm that tissue up fascially. And these are related to the hip in reflexology terms, and lower body innervation, sciatic. Just kind of loosen those up, open it up, add some intention, some heat. Not digging, I'm not trying to make her jump off the table. Next, I'm going to use like a flat fist and lift the calf up away from the bone, as opposed to deep tissue massage where people are trying to dig through the bone, through the table, and do trigger point work. Is super sensitive on the gastroc and soleus, fibularis under there for the runners. So I'm just going to kind of lift and rotate a little bit, lifting up and away, getting that. It's kind of another myofascial release technique. I'm just lifting it up away from the bone and seeing how much play I have in the muscle. Kind of brisk. This would work at an event, any kind of sporting event where you're warming up runners or cooling off runners. Where are we next? Next, we are going to try to mobilize the hip again. I'm going to lift gently at the ankle joint because I'm trying to create motion in that joint, because the reflexology connection is from the ankle to the hip. So if I just gently lift, I'm decompressing all the pressure and impact that normally goes through the heel, through the leg, and the body. So I'm doing the opposite, kind of anti-gravity with just a little shake. Should be really easy and comfortable on me. Shoulders down, and get a nice stance. And again, I'm seeing a lot of motion all the way up through here. This is a good assessment tool if I'm going to do more massage later on the upper half, if I'm not focusing just on the legs and feet. I'm seeing more tension left shoulder than right, more movement on her right side. So that's going to be 10-20 seconds, just warming up everything. I'm thinking a lot more neurological throughout this routine and reflexology, more than deep tissue massage or even like sports massage. Next thing, I'm going to do an intermittent pressure we talked about earlier. Same concept. I'm telling the nerves that something is different. It's on off like a switch. It's not even really a stretch of the quad that I'm doing. I'm not going to sit on this and try to push it and tell her to breathe and do a bunch of back and forth reciprocal inhibition kind of stuff. Just movement. I'm pumping, priming the pump for the sciatic nerve. I'm telling, hey, sciatic nerve, we're going to be talking together for a while. And I can also move this lateral and medial rotation of the head of the femur in the hip. It's going to give me some of the same neurological conversation. And again, super easy on me. I'm barely doing anything. I'm just kind of dancing back and forth, swaying. Novelty to the nervous system. Gentle novelty is going to be relaxing to her.
It's very relaxing.
Feels good?
Yes.
Not intensive?
No, not at all.
Great. All right. And if you would, turn over onto your back. And move down a bit. This will be under the knees. Any questions about the prone?
No, that
Stuff
looks
makes
good.
sense?
And that, yeah, and you could see the
Let's go
alignment,
here.
the movement in the body.
That's really
Roll
neat.
there.
Yeah,
Okay.
from right here, this position, I could see, like where you're talking about, you could see it moving all the way
Right.
up to the upper body or not.
That's really cool.
Take a look.
Thank you.
I'm trying to make her nervous system as happy as possible. I want her to know that I'm being nice to her. And her brain not to think I'm a threat
Here,
or
take
that
this,
I'm a
take
risk.
this. I'm gonna stand
Oh,
here.
okay.
Oops, sorry.
That's fine. I've got this.
Okay.
Here. My cheat sheet again. We're going to talk about prepping the nervous system along the same lines. And when you have high performance feet people who come in tennis shoes, it's always handy to have some nice like hand wipes.
Yeah, sorry about that.
No worries. And if they're self-conscious, this always will help. And it also is doing something good neurologically. It's creating a cool, refreshing kind of stimuli, which is different than what they've been feeling all day or ever. How often do people come and do cool and refreshing things to your feet? Incidentally, any allergy to tea
No.
tree oil or lemon?
I don't have any allergies.
Essential oils? All right.
No.
I'm not a huge essential oil person, but those two I really like for the feet together because the tea tree is good for antifungal and anti-everything else that might be a little creepy on the feet if you have somebody with creepy feet. And lemon is good for lymphatic movement to encourage relief of edema. And another thing I like if I'm out at an event would be Listerine in a spray bottle. I used to work at the beach in like a tent right on the beach. So people would come in with really messy, sandy feet. And I would just hose them down with the Listerine spray, like the orange scented
Yeah.
spray. And that does the same thing. Gives you a cooling, nice
Oh,
feeling.
look at that.
You'll notice I have this nice like polyester blend, no cotton at all in this. This is a plastic blanket essentially, which is like a moisture wicking garment that if you were to spray something on here or get fluid from a towel or something, it's not going to get on your table and not going to get on all the pads and everything,
Oh.
which is why we use those for that. We can also use hot towels for the same thing. It's a novel experience for the nervous system on the feet. There's so many nerves in the feet.
What kind of towel is it?
Towel.
This is a bar towel.
Cotton.
Yeah, just terry cloth towel. I get these at IKEA. They're like 40 something cents a piece.
Okay.
Bar towel. They're great size for the feet. And you can also wrap the blanket up to insulate the foot. So it has a nice, cozy, safe environment. So your brain is thinking, man, this guy really is taking care of me. He worries about how I feel. This is a therapeutic environment. I feel totally comfortable. I could go to sleep. Which is a very typical reaction to reflexology, usually. So a couple little compressions feel great. And all of these changing stimuli are going to be important as well. Because as I take off the hot towel and damp towel, I'm going to put on a dry towel that's kind of cooler because it's at air temperature. And it's a little rougher feeling because the texture of the wet towel is going to be different than this.
Huh.
So I'm still thinking neurological information. How am I able to gently have a conversation? What's my opening line to your brain?
Wow.
As opposed to me trying to attack your musculoskeletal system with enough pressure and intensity to compete with the impact of gravity that's there every day. We could also apply some kind of balm or icy hot. I was taught in my traditional Thai massage class for the feet to use Vicks Vapor Rub, essentially, and just around the ankles. Really appreciate that, or the knee joint where we're not going to be digging into anything because that's not super comfortable. A nice balm, an icy hot, a tiger balm kind of thing can be really great for your athletes. And then we're gonna do some techniques. Add to that. So I've spent all this time prepping you. You should feel comfortable and happy,
Yes.
warm and clean, and not self-conscious anymore about whatever kind of shoes you had on. We are going to start with some sustained points with gentle pressure with our thumb tips. We're going to start with the upper trapezius point, just like walking up behind somebody and giving them a nice little squeeze on the shoulders, like, take a deep breath, relax. This is where the head and neck zone meets the shoulder zone. So just like the top of the shoulder in that like levator scapula, upper trap kind of area. It's that webbing in between the two. I'm going to hold that 30 seconds or several breaths if you want to try to be more in tune with your breathing cycle than with seconds on the clock. I don't really like to watch the clock very much. Next one, solar plexus point, right underneath the third toe at the diaphragm line. I'm going to hold that several seconds. The solar plexus is the nerve bundle that's in charge of the autonomic nervous system. So all of the involuntary stuff that happens all the time without us thinking about it, like heart rate and respiration. So we're trying to ask the brain, is everything optimal in my breathing? Is everything optimal in my heart rate? Is my blood pressure too high? This is going to help regulate that. Then we can apply some kind of lotion or balm or cream. Typically in reflexology, we don't use very much of anything. This is straight coconut oil. And I even have kind of a lot of that. I just want enough to be able to move without gliding and slipping and sliding too much. So I'm going to do a flush of the lymphatic reflexes, which are on the dorsum of the foot, which we didn't actually talk about, but I hope you'll believe me that I know what I'm doing. It's kind of flat and it is a little gliding. So we're just trying to push the lymphatic fluid, just like a lymphatic drainage kind of technique, just a real slow, flat, wave-like pattern down the foot. which a lot of people who have puffy feet, it's right there on top of that area. So if they have swelling, if they've been in the same shoes all day, they've been on their feet for 12 plus hours, they might have some fluid there. Then we are going to glide up the plantar tendon from the pelvic line to the diaphragm line. So straight up that tendon, gently, just sliding deep enough not to tickle, but not deep pressure. This is not trigger point. You probably are going to feel some bumpy stuff along the way, but it's not like anything you're going to dig into. We're just relaxing the foot, introducing ourselves to the foot. We're going to do that 5 times, up and down, and then we're going to crisscross, up 5 times, straight up that plantar tendon. Then we are going to glide with whatever of that lotion or cream is left all over the malleoli, medial and lateral malleoli, and up all over the top of the foot to warm up all this stuff. These are the groin reflexes, also very pertinent. Hip flexor stuff, all parts of the glutes and hips, all around the foot for our high performance people. And that feels really nice. There's a lot of nerves in there.
It feels so good.
And I'm barely sliding and gliding. I'm shifting the tissue around like a myofascial technique. All right, moving on. We are going to go through reflexes for all of the major joints of the body that we talked about. The head and neck is represented in reflexology in the toe. We're going to do gentle circular pulling, meaning not a yanking, not a popping, not anything abrupt, just a couple fingers and the thumb, circular motion, gentle pressure away, decompression more than traction. And we're going to do that circular motion about 3 times. We're going to plantar flex, hold for about 7 seconds. Dorsiflex, hold for about 7 seconds. And then 3 more circular pulls on the big toe, representing the neck and occiput joint. Dorsal valley between toes 1 and 2 would represent the scapula region. So we can do finger walking. You could do thumb if you wanted to, down in between the 2 toes. I like all 4 of my fingers would be comfortable. You can support the foot underneath and just kind of go through that groove in between until you run into the tarsals where there's not a groove in between the metatarsal. So we're going to go through that groove 3 times. You usually get a lot of oohs and ahs from that too, because very rarely do massage therapists touch the top of the foot in that way, but it's very comfortable and nice. Then we're going to talk about the shoulder reflex in between the 4th and the 5th toe on the ball of the foot. Represents horizontal zone 2, the chest and neck and arms. Or I'm sorry, chest, heart, lungs, arms, the whole axillary girdle. So we're just gonna kind of move that as if somebody is, moving their shoulder around, warming up that joint of their body. Kind of supporting the 4th metatarsal and gently moving forward and back that 5th toe and metatarsal. Kind of warm up that tissue. Next one is twisting the whole foot as if we're twisting the spine back and forth. A nice twisting, torquing. Very gently. I've seen therapists just wrench this over and try to get things to pop and crack, and that's never good. So hold it about 3 seconds each way, several times. We're just going as far as we comfortably can get some movement and some play. Affecting, these are all the spinal reflexes, sacral, lumbar, thoracic, and the cervical up in the toe. So you can see that's moving, relaxing through there. And then we're gonna rotate the ankle about 5 times each direction. And that is correlated with the hip joint. Reflexologically. I don't think that's a word.
It's a new word. We'll put it in.
Reflexologically. Make an adverb out of it, whether it likes it or not.
Okay.
So about 5 times each way. Again, gently. You don't have a perfect, absolute circle. You gotta go with what you have with the movement. Then we're gonna do some actual thumb walking on the plantar surface of the foot. So, let's pull it on the touch. Whoop, a little closer. So, we talked about the zone intersections or convergences. We're going to do zone 2 because we already did some work on the toe, the big toe. We don't need to spend a whole lot of time there. So we're going to go, all of horizontal zone 2 is from the diaphragm line to the shoulder line. And then we're going to go along vertical zone 2 in horizontal zone 2 where they cross over. So a little bit of thumb, 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 thumb. And everybody's foot is going to be different. There's no, you have to do it 7 times or you have to do it 4 times. Depends on how much time you have. Overall, how much tension is in that area. So gently, 3 times top to, or bottom to top of that zone. Then we're going to jump to 3 and 3, which is under the diaphragm line and in between the waistline and the diaphragm line is horizontal zone 3 in line with toe number 3. It's going to be about there. And if I felt something that I wanted to dwell on a little more, that's fine. I could put a little time into it, a little more pressure, but 3, 4, or 5 seconds max. Kind of like if you were doing a Swedish massage and you felt something a little bumpy, you might press into it a little more, but you don't want to, break the magic spell of them relaxing. Ultimately, you want them to be relaxing the whole time. And then number 4 and 4 is between the waistline and the pelvic line. Under toe 4. About 3 times. Gently walking. You could do whichever thumb you like. And 5 is under the 5th toe in zone 5, which is the heel. And I usually hold it with one hand up a little bit to give me some laziness so I can be as comfortable, and my elbow can kind of rest on the table. So I'm doing nothing with my body except a little bit of thumb motion from bottom to top about 3 times. And a lot of times it's tempting to dig in more because the heel is so thick and dense. But as we talked about with plantar fasciitis, when you get that spot that's inflamed, they will jump off the table. It's super intense. So you still want to be super careful and mindful that you're not making them jump off the table. And we are being respectful to the nervous system and not trying to plow through something, as some reflexology methods suggest. So we've gone through all the convergence points. We talked about the cuboid notch, which is easier to show on this leg right now. The triangle here under the cuboid bone. The cuboid is the lateral bone directly articulating with the fifth metatarsal. It feels like a little triangular area. The knee reflexes are here, calf, lower leg on the plantar edge of that triangle, hamstrings up the proximal edge of the triangle, and distal edge of the triangle would be quadriceps group. So we are just going to kind of finger walk around there with a fingertip and just kind of trace the triangle around. And this too can be really touchy and really jumpy if there is a knee problem or any kind of significant damage or strain or cramping going on in the legs.
Oh, it would be sensitive, and then what would you do?
Well, that's the benefit of doing the reflexology,
You would
just tracing
stay
around
light.
here.
You would just stay. Yeah.
Right. Maintain that medium to light pressure throughout the entire routine. So then we're going to jump back to this foot to the medial side, where the spinal reflexes are. I just jumped over there for the sake of the video. We would do all of this on the same foot and then go to the other foot and do all of it. I've spelled out here lumbar, there's 5 lumbar spine, 12 thoracic spine. Sometimes I count it that way in case somebody is like, oh, what's that? Where are you? And I can say, oh, that's about L5, L4 is where I feel more tension than L1 or 2 up here as I go up the chain. And again, you don't have to do exactly 17 bites with your thumb walking up from here to there. We're just generally going from pelvic line up to the bunion area and just doing lumbar and thoracic right now. Thumb walking about 3 times, bottom to top. Then the sciatic reflexes, again, I'm on the heel, so I'm going to kind of lift this up and let the foot flop out a little bit so I have some area to work without trying too hard ergonomically. I'm going to do 5 times across the sciatic nerve reflex on the heel, horizontally, 5 times. Lateral to medial. And then a technique from traditional Thai massage, which looks a little invasive and a little funny, but it's, I think it feels great. And for people who are used to getting sports massage or at an event getting warmed up, this is amazing. It's a slappy dropping kind of motion. You're letting the foot drop and slap against your hand. So again, you're not doing any work. The gravity and the plopping is kind of, and you can do that about 10 seconds, 15 seconds. And again, that's warming up all of those dense connective tissues, fascia, the fascial bags Eric Dalton talked about in the video. And I'm getting motion all the way up through the body. I'm able to see movement in the hip, shoulders, her head's bobbing a little bit, something like that. And then we are going to flex and point the ankle now that it's all warmed up and nice and energized. We're going to start with the kind of the arch of the foot. and 3 seconds down. 3 seconds up at the ball of the foot, gives us a little deeper stretch through the calf. And we can kind of rotate this a little bit, get a little movement, that three-dimensional flexibility I was talking about. And then the toes are going to give a little bit different stretch, more of the plantar tendon
I look at that, yeah.
and through the ankle and the quad. So we're going to do, it's again a Thai massage technique, kind of a lower pressure, moderate pressure, deeper pressure or deeper stretch. But none of it should be so intensive that it feels like she's being stretched out.
Mhm.
You know, it's again just flipping that light switch, telling the brain, this could move, this could be better, or this is great. The brain is making those decisions. And through the toes. And then we would repeat all of that stuff on the other foot, the whole supine routine.
Mhm.
And then I'm going to show you the rest of the routine, just the other pieces of it, and then let you get on this foot and do some stuff. Pounding of the soles. I'm using like the soft part of the fleshy part of my fist, kind of loose fist, lifting this here. And again, the foot can withstand an amazing amount of impact. So this shouldn't be super intensive. This is another traditional Thai technique. Just up and down the foot, several seconds. Plantar surface. Then we're going to do a quick stretch to help open up the hip and the sciatic, which would be excellent for plantar fasciitis. I usually drape this with the sheet to the knee, but she's wearing pants and don't have a sheet here. But I call this a lazy lunge stretch. It's as if she was doing a lunge, but she's on her back, not on her feet. So this knee is coming down and out and back this way. I'm not trying to do this kind of stretch. This is great because it leaves the lumbar spine stable. If there's any kind of degeneration or disc issues in the spine, this maintains stability throughout the spinal complex. And I'm going to take the ankle and try to arc it this way, make an arch this way. So I'm getting a torquing of the leg instead of a pinching or a crossing over like a typical piriformis stretch that crosses over the body and could impinge the femoral artery and nerves in there. I'm always thinking opening and loosening and lifting up and away. I don't want to pinch, I don't want to push, I don't want to poke. And again, I can make this intermittent. I can take that same theory all the way through. A little bit further and relax. Light switch on, light switch off.
My back just cracked.
Yeah, I just heard
Felt good.
something. And that was your brain adjusting to the situation.
Yes.
Your brain said, hey, this could be better. How can I loosen fascia or loosen muscles or send more blood flow? What do I need to do to make this better? Because I didn't do that. I didn't touch anything in your spine. And again, this should be totally easy for me. I'm just cradling the arm, letting that lever against the table. And the other thing, if they are limber enough, I like to pull both legs down the side. I call this a John Wayne stretch, like typical cowboy legs. And if not, you can do one at a time.
I don't know if I'm limber enough. I don't think I am.
Well,
Yeah.
good. Are you gonna hate me if
No,
I leave
no,
you like
no,
that for a
no,
minute?
I'm
All right,
fine.
great.
I didn't think I could do that.
Yeah, so we have the legs draped on either side of the table. And for modesty's sake, with draping, you'd have a big bundle of stuff all over anything. So again, thinking of stretching, I'm thinking of torquing the upper leg instead of stretching per se. I'm getting a three-dimensional movement out of that joint, and out of the head of the femur is going to give a little bit of play, and some hip flexors up here. All of this stuff, of course, super important for high-performance feet people. And I can just gently flex the knee a little more, and I can get a little pull against me, pulling the ankle away from the edge of the table towards me, and you'll know fast what the limit is, where the range stops you, and you should be able to feel, if you pay attention, where in this is their restriction, like, right, what's holding back the movement. And of course, be cautious if there's a knee injury or any kind of compromised joint. But again, spinal situations, this would be totally safe because I'm not moving the vertebrae around. This is all kind of, I guess, centralized on the hip and leg. And I'm able to move comfortably. I could do this. I could be sitting on the stool. I'm just squatting down comfortably now. I'm using my body weight. I'm kind of leaning back against her. I'm not doing any pushing. I'm not muscling anything. I'm just holding myself up so I don't fall on my butt. And I could run to the other side and do the same thing. As that one gets looser, and same kind of idea, just.
That one's got a limitation to it, yeah.
Right, and there's a lot of cushioning here, and she's not
And you
perfectly
haven't
straight
done,
on the
and you
table,
haven't done
that
all
good
the
stuff.
other stuff to prep that leg.
Yeah, exactly.
Yeah,
Good
that's a
point.
huge thing, that you haven't done
Thank
everything
you.
to prep that leg.
So this
Yes.
leg does feel a lot better than that one, yeah.
Okay.
Oh, yeah,
That's-
your
thank
left
you
leg
for
probably feels like
mentioning
it can
that out
touch,
loud.
yeah. Yeah, your left leg probably feels like it can touch the floor.
Feels, yeah, that's good.
All right.
And it's actually
Good,
dropped
good
lower than your right leg.
But you're gonna fix that, right? Or you're
Absolutely.
gonna do
Right,
that.
yes.
I'm gonna fix that.
So, yeah, after that, you would go back to the first leg and start over. And that's all detailed in the notes there of what order to do things and how to do everything. You would also do the relaxation techniques again. And I think that's all we need to do for the camera.